Welcome to my channel Medicine Guide. Hydroquinone is administered topically by applying a thin layer on hyperpigmented areas. To treat melasma, dermatologists will usually suggest once or twice daily administration for at least 3 months. Proper and even application is essential, as failure to do so may lead to irregularities in color. Regular consultation with a dermatologist throughout the treatment period is important to assess the patient's response. Adjustments can be made on the prescription depending on the rate of improvement and occurrence of side effects. Hydroquinone can be continued even after resolution of melasma as maintenance therapy. This usually means scaling down the frequency to once or twice weekly use. However, you should always be guided by your dermatologist. In the last video we have discussed all about hydroquinone. Now in this video, we will discuss how hydroquinone is used in different combinations. So let's start. But before that, please subscribe to my channel Medicine Guide. Hydroquinone in different combinations. Formulations for melasma usually contain 2 to 6% hydroquinone. In some countries, it is possible to buy over-the-counter products at 2% concentration or less. However, in other areas, a prescription is required to purchase hydroquinone-containing products, regardless of concentration. In Australia, prescribed strengths of hydroquinone 4% and above need to be compounded in a suitable pharmacy. It can be made as a solution, emulsion, cream, or gel. Some products use hydroquinone as the sole active ingredient, while others use it in combination with other ingredients for added skin benefits. These include retinoids such as tretinoin, antioxidants such as ascorbic acid, alpha-hydroxy acids, and other lightening ingredients such as licorice root extract, azelaic acid, and tranexamic acid. Kligman's formula is one of the most prescribed products for melasma. It is a combination of hydroquinone, tretinoin, and a corticosteroid. The original formula started as 5% hydroquinone, 0.1% tretinoin, 0.1% dexamethasone, Kligman and Willis, 1975. The addition of tretinoin improves penetration, add additional depigmenting power, and improve the texture and appearance of skin. Dexamethasone was included to counter the inflammatory and irritating effects of the other two ingredients. Over the years, many modifications to Kligman's formula have been made. The concentration of the components may change and corticosteroids other than dexamethasone may be used. Generally, these triple combination creams are very effective at treating melasma, with all three ingredients working together to improve skin appearance. However, clinical trials are continuously being done to find the best iteration of the triple combination cream, one that is able to deliver the medication in the safest and most effective way possible. Other combinations of hydroquinone are Tri-Luma, a popular brand that contains 4% hydroquinone, 0.05% tretinoin, and 0.01% fluocinolone acetonide. Tri-Luma cream we have discussed in another video, link is shared. Hydroquinone Forte Gel contains 4% hydroquinone, 3% dioxybenzone, and 5% padimate. Nuquin HP contains hydroquinone with alcohol, propylene glycol, and sodium metabisulfite. Solaquin Forte contains hydroquinone with propylene glycol and sodium metabisulfite. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer: channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you watching the video. Please do not forget to like, share and subscribe to my channel Medicine Guide.